Brittney, you talked about the patient experience being really important to you as part of your position. How does all of this ultimately impact that patient experience, and why should patients be concerned about the types of PACS systems and the types of images that are being presented to the doctors?
I think one thing that we've really done a great job with our technology is being able to have it in the cloud and have it easy accessible. And as a patient, right, you go through, you come and get scanned, you're waiting for your diagnosis, and then you know you're going to get called from your provider, right? And you want to be able to see your images, right? And you want to take them to your providers, or you might want to show your aunt or someone else to get a second opinion, right? We hear this all the time. But with our solution, we're able to actually look at the images digitally. And I always like to try to think of it's like Google Photos, right? Everyone's familiar with Google Photos. They go in, they see their images, they can share it to like their best friend, their family member. Well, we have that exact same technology, but for images where it's super safe, super secure, and then they can access it and send it to their providers, look at it themselves, or also go for a second opinion.
So why is that partnership important, and what aspects of SDMI are you looking at? Who are you talking to? What's kind of the feedback that you're getting?
You know what's amazing about our partnership is you're very focused on cutting technology, like cutting edge technology. What I mean by that is, you know, what's new, what's safe, secure, and also what's going to improve overall patient care. And so there's a lot of times when we're coming out with new features that we're building out in the cloud, we actually partner with them for feedback to see how would it impact the day in the life of the radiologist all the way down to the patients.
Can you give me an example of some of those features?
There's been a lot of features that we are looking at that we currently use with your normal radiology PACS, and how do we bring it, but how do we improve that?
Some of the other ones maybe, like, you know, everything is always focused around optimization and efficiency of the radiologist, right? That is, you know, the goal is to provide the diagnosis for the patient as quickly as possible so they can go on with the treatment. So we're focusing on leveraging tools and features that will help prioritize, like maybe focus the radiologist to the maybe more urgent exams, or help them organize their daily workload so they can not have to switch constantly between different types of studies, or they can make them a little bit more efficient. So every time we release a new feature, we do work with Josh and the team to implement it, and when we follow up and see how it works with the radiologist, right? Is it actually helping them? Does it actually make them faster? Does it actually make them more easier to view the images and create the reports? And therefore, again, everything comes down to the patient care, right? The faster, the better, the quicker this is done, hopefully the happier outcomes will be for our patients.
Josh, give us some insight on what the radiologist workflow looks like, right? Back in the day, I remember as a kid, I would go get an x-ray and they take you down to the development room and you get this kind of cool experience of getting to see how everything worked. But now with everything being digital, patients get off the table, they walk out the door, and they don't really get to see what the radiologist is doing. Can you give us a better idea of kind of what their day is like from the PACS side of things?
Once the patient is imaged and is hopefully on their way, the imaging goes to the PACS system, and the radiologist then uses some of the tools that Vanja was just mentioning with the work list that helps prioritize what needs to be read, when and how quickly. So the radiologist will use that work list to select the next study that they need to read. It will launch into the PACS image viewer. From there, they can manipulate the images in any way that they need to, change contrast, brighten, darken, rotate. For some images, they can create a new plane of view within the what was captured by the actual modalities, and then from there, they'll dictate their assessment of the study, of the exam, and sign it off, and from there the report goes to the referring providers and is then available for the patients as well.